Thank you very much, Nick, and thank you so much to all the previous speakers. And most importantly, thank you to all of you for coming along today and for supporting this event and for your obvious passion and commitment. There are so many things that the world should be thanking Wales for. Clearly the arts, literature, poetry, song, rugby, dare I say. I say that even as an Englishman, actually not just an Englishman, a Bristolian. There's so many things, but the most important thing from my perspective is without doubt the NHS. So let me quote Nye Bevan, 1948, when the NHS started. He said, "Despite our economic and financial anxieties, we are still able to do the most civilized thing in the world. Put the welfare of the sick in front of every other consideration." He said that in 1948. We have financial and economic challenges now, not as great as they were in 48, but still significant. And our commitment to continuing to put the welfare of the sick and those who might become sick, all of us, remains so important. The welfare of the sick for us as GPs means our ability to understand our patients and our ability to build relationships with our patients. That's what being a GP is all about. So general practice is not production line medicine, or at least it shouldn't be. It isn't the practice of medicine that can be done at pace, or at least it shouldn't be. Seeing your doctor is not like buying a washing machine. It's not a transaction. Relationships are so fundamentally important to everything that we do. And we know from research how important relationships are, and I make no excuses for repeating what Rowena said earlier. If I see a patient who I know and who trusts me, I know that patient is more likely to be satisfied with the consultation. They're more likely to follow the advice that I give them, including more likely to take medication that I prescribe for them. They're more likely to get better outcomes. They're less likely to go to emergency department. They're less likely to go to hospital. They are less likely to die, remarkable as that might seem. The overall costs to the NHS are less. And actually, I'll be happier as well, which is not unimportant, I guess. So there are so many benefits to relationship-based care. I guess as GPs, we've got lots of interventions, lots of things that we can do for our patients. We order investigations for them. We refer them for surgery. We prescribe medications for them. But of all those interventions, almost certainly, the nature of that trusting relationship is the most effective one. Yet we don't talk about it enough, or it isn't recognised enough, particularly, I think, in policy circles, and that's why it's so important. And we have personal stories as well. I want to tell you about John, who's a patient of mine in my practice in East London, in Newham. He's been registered with me for about 7 years. He's not a frequent attender. He's a well guy, but I've got to know him pretty well over that time. I know he's a very keen ultramarathon runner. And he developed pain in both of his lower legs, in the front of both of his lower legs. And he went online onto the Babylon chatbot, which is something that I hope you don't have too much access to in Wales. And he entered his symptoms. Took him about 28 minutes to answer 32 different questions, one of which was not, have you been for a run recently, incidentally. And he was told by the chatbot that he either had a bunion or something called Charcot's joint. And for those who don't know, Charcot's joint is a problem associated with syphilis, and he didn't like that thought of that diagnosis at all. So he came to see me, his in vivo doctor, in order to find out what was really going on. And I said to him, "What do you think's wrong?" And he said, "I think I've got shin splints, doc." And I said, "I think you're probably right." So I asked the typical GP question, which is there anything else on your mind? Is there anything concerning you? And he said, "I'm really pleased you answered that question. I feel really silly, but I know I can open up to you." He said, about a year ago, a friend of mine who was also a keen runner developed pain in one of his legs, and 6 months later, he was dead from a sarcoma, a very rare and very malignant tumour of the leg. And he said, "I know I'm being silly, I know I'm being irrational, but I just wanted a bit of reassurance." And because he knew me and because he trusted me, I could give him that reassurance. So what didn't I do? I didn't order an X-ray about £90 to the NHS, because it wasn't necessary. I didn't order an MRI scan, about £230, because it wasn't necessary. I didn't refer him to an orthopaedic surgeon, about £350, because that wasn't necessary either. I could provide care for him and reassure him, essentially for free, or not far off for free, without intervening, without medicalising a problem. And that's what we do as GPs. That's how we use our relationships. It's so important. And that's why we, as a college, the Royal College of GPs, is talking about relationship-based care. It's why Rowena is emphasising its importance in Wales, but across the whole of the UK as well. It's why it's so important that all of us engage with the concept of relationships. We know what we need to do to deliver better relationships than perhaps we're able to do at the moment. We need to create time, most importantly. We need to see fewer patients for longer, because you can't build effective relationships and utilise those relationships in rapid transactions. We know that we need to think differently about relationship-based care, as the Minister said. The days of one patient, one GP for 40 years they still exist in some parts of the country, Rowena, but they don't exist in most parts of the country. So we have to think differently. We have to think about relationships being delivered by teams, by multidisciplinary teams, and we're doing that. And of course, we have to measure relationship-based care as well, because if we don't know how well we're doing, we won't be able to improve as well. So there's a number of pretty straightforward, pretty simple things that we need to do in order to improve relationship-based care and make us more effective for our patients and more effective for our communities as well. So your support in achieving that is so fundamentally important, and we're very grateful to all of you for coming along today, and good luck to all of you. The college is here to support you and help you. Thank you so much.